Hello, my name's Claire, and this is my friend Ava. Ava, I'm glad that we can see the doctor when we need to.
Most children in Haiti never have an opportunity to see a doctor, and 1 in 11 will die before the age of 5. But the Haiti Medical Project is making its 4th mobile clinic visit within a year to this remote village, Acajou. For anyone outside of Port-au-Prince, it is easier to bring the clinic to the people than it is for the people to get access to a clinic. This is Paul Olominick at the end of a return trip to volunteer in Haiti.
But I'm not aware that there's a team of Haitian physicians that are doing these sort of rotating clinics where they come back intermittently and see people again. I haven't heard of that, so I don't know that it's unique, but I sure haven't heard of any other group that's doing it that way.
Just as the medical model is relatively new, so is the organization and funding mechanism. The Haiti Medical Project is a Brethren ministry with organizational support from the Mission and Ministry Board of the Church of the Brethren. Operational decisions are made by the Haiti Medical Project Coordinating Committee, yet its funding is completely grassroots, over and above heart-inspired giving by congregations and individuals. You can unite with us and the Church of the Brethren in Haiti to help curb the infectious disease death rate that is triple that of other Caribbean nations. With regularly scheduled mobile clinics, what is now the Haiti Medical Project is an answer to the prayers of Haiti's heart.
Et là, nous prions avec la foi. Mais quelquefois nous-mêmes, nous pas gain l'argent pour aller à l'hôpital, nous pas gain manger, nous pas gain caille, nous pas gain docteur, son seul monde nous prend qui capable faire toute bagaille, ça ban nous plus la foi dans bon Dieu.
After the 2010 earthquake, local leaders of the Church of the Brethren in Haiti strongly urged a medical response to unite with the housing, food, and trauma counseling response from Brethren Disaster Ministries. So Brethren Disaster Ministries created a mobile clinic that brought immediate care to over 1,300 persons in 5 clinics in a single week. Later, this experience would serve as a partial prototype for clinics organized by the Haiti Medical Project.
Yo aide socialement, yo aide spirituellement et yo aide tout mentalement. Ceci veut dire que là, c'est dans tout sens, yo élargi tout travail que bon Dieu te mette.
With hearts grateful for this successful partnering, the Brethren in Haiti invited the Haitian and U.S. medical providers to continue their ministry in the poorest country of the Western Hemisphere. Since there is completely inadequate care for people of modest means in Haiti, the local Church of the Brethren leaders hope to demonstrate God's love to the people in all of their communities. Paul Olominick recalls the early discernment on a faithful response to this calling.
And it was through the process of discussions with people here in Haiti, some of the physicians that were interested in making this program happen, some of the church leaders as far as what they thought would be helpful, that we came up with this outline for this medical program. Having just come back here and worked with it, it's doing what we had hoped that it would. It's getting providers, physicians, and nurses and staff out to areas that don't have any care at all.
Rather than depend on expatriate doctors as many other organizations do, Haiti Medical Project uses your gifts to provide Haitian medical professionals who can schedule regular mobile clinics. Local medical professionals give culturally appropriate medical service in the local language and in partnership with local congregations. In a country where currently only 1/3 of the population is fully employed, investing in local talent and the local economy is good for the future of Haiti. This truly is a local project that partners with the Church of the Brethren in the U.S. for support in prayer, oversight, and funding. Congregations of the Church of the Brethren in Haiti see Haiti Medical Project as a key mission program. Haitian congregations help organize the clinics, publicize them, care for the physical setup, and provide volunteers to assist with the clinic's operation.
Nous avons environ 16 l'église en Haïti. Aux environs, nous sommes capables de dire, en Haïti, l'église des frères atteint près de 500 membres, plus de 500 membres. Et parce que de jour en jour, l'église va grandir en effectif.
Through our collective efforts, the local churches are now making new impact with the mobile clinics in about half of the communities where there is a Brethren Church. The Haiti Medical Project Coordinating Committee envisions more life-giving and saving ministry in their communities. And with your prayer and finances, it is possible. Based on your generous giving, a program based around 16 mobile clinics and costing $30,000 has grown to a response requiring about $80,000 in 2013. The number of clinics was increased by 50% to make possible recurring service to 2 additional communities. A fund for extraordinary medical needs has been established. A small building was provided as a project base and as a national church office. A survey of health needs and practices was initiated in 20 Brethren-related communities to assist in setting program priorities, and exploratory work in public health ministries was launched. Looking ahead, we hope to be able to respond to the strong encouragement of the Haitian leaders to provide more clinics and serve more communities in partnership with local Brethren congregations. And we want to develop and expand preventative care through public health ministries. Some of the preventative care areas being explored are community education, focused on priorities for water purification, latrine construction, and improved sanitation. Exploration is also underway for ways to provide improved maternal care and to train midwives to more adequately assist in the birthing process, which will combat the high birthing mortality rates. These developing additions to the Haiti Medical Project will unite our current curative care with preventative medicine for even greater impact. In addition to funds needed for immediate program use, it is important to develop mechanisms to ensure longer-range support of the project. One of these is an endowment fund, intended to reach $600,000, at which point it will be able to provide annual support of about $30,000 to medical projects. This fund already is off to a great start. Congregations and individuals may support Haiti Medical Project by providing funding for immediate needs or for the endowment fund.
La présence de l'église frère dans le pays d'Haïti, il vient faire une très grande différence avec l'autre l'église. Ça arrive surtout, c'est parce que l'église frère y aurait la vie moun surtout. Y aurait la vie moun. Tant que leur moun yo en difficulté, l'église frère toujours intervenir pour capable aider moun so capable face à problème.
Now the hearts of caring people across the U.S. are united with the vision of Haitian brothers and sisters through this faith-based medical partnership built on over and above heart-inspired giving by congregations and individuals. Thank you for your prayerful support.